all they're asking you to do is to do a simple test which comes through the post to you. It comes to everybody between the ages of 50 and 74. It's done every 2 years, and what they're trying to establish is there any bleeding, any occult blood that's showing up in the stool. If it comes back as a positive test, you're then put forward for a second test, what they call a colonoscopy, a camera test, and what that'll look is have a look at the bowel, check if there's any obvious bleeding. Bleeding could be piles, it can be colitis, it can be you've ate too much black pudding, it can be irritable bowel, or it could be a cancer. I think, especially with bowel cancer, the earlier it's picked up, the best chance of a cure. So what they're kind of saying is that if it's picked up, as an early Dukes or a polyp cancer, it can be completely removed. You're cured the cancer at that point. So it's really, we're really keen to pick up early ones. I think part of the problem we have is people have symptoms, they're very vague symptoms, but they ignore them. They just think, oh well, it's, I've ate something dodgy, or, I've got piles, or they kind of self-diagnose is probably the biggest problem, or they're too embarrassed to go and see about it. Is really what worries us. I think, the fact that they won't go, because when you go back through, even though they do the test and they think, no, I've never had a symptom, when you sit and talk to them, they have had, they've had a change of bowel habit, they've maybe lost a bit of weight, they've had a wee bit bloating, they've had a bit of abdominal pain, but it's been vague, they've had diarrhea, they've had a bit of bleeding, but it's only been on paper, so there's a lot of different things that go on. And once you sit down and say to them, well, these are the symptoms, that's when it ties up. That the fact that the test covers people from 50 to 74, but it doesn't cover earlier than that, and we have young patients with cancer. That's a real worry for us, that people think it only happens to over 50s. And the other worry we have is that if people do the test and it comes back negative, if they do have symptoms, they don't go and see the GP because they think because the test is clear that definitely nothing has happened, and we know that that's not the case as well. And the other thing is to do the test every time it comes in, because again we've had people who've had maybe a first test clear, but the second test picks it up, because it only depends when the bowel is, if there's bleeding in the bowel at that particular time. If there's any symptoms in between, you're trying to encourage people to go to the GP. Right. Don't wait for the test to come in, because we've had people saying, oh well, I had symptoms for a couple of months, but I knew that I would get a test, so I just waited. And I think that's where the adverts are probably helpful, because what they're doing is they're making people think about it, and especially men, I think they're a bit reluctant to do it. But what you always find is if we have one of them that's probably their wife has nagged them into doing the kit, and it's picked up, they then tell their friends, and they then pick them out the drawers that have been lying in for months and decide to do it. So it is quite a, it has a tumbling effect where if you finally get one, you get 2 or 3 from it.